if you're a practitioner and you're not dealing with the mind-body integration, I promise you, you are missing out. Guys, today I have Dr. Mark Sylvester, I have Megan Earls, and we're talking about SST therapy and how vital it is to deal with trapped emotions, trauma, all those sort of aspects to really help our patients heal. Guys, when I talk about with clients, but also with my doctors I train, other practitioners I work with, one of the key factors always is what I call stressors. That could be current life stressors, that could be trapped emotions, that could be CPTSD, whatever it is. You have to deal with it with your patients, whether you deal with it yourself or you refer out to someone who does. So today we're going to talk all about that and how SST therapy can transform your practice. Guys, thank you for being here. Let's jump in. Just give people a 2 sentence intro into your background real quick. Megan, start for me. What's your background and just maybe how you got into using SST therapy?
Hi, thanks for having us. I'm Megan Earls. I'm an LCSW out of Sarasota, Florida. I've been in practice for about 20 years. I'm a trauma specialist and focus predominantly on how do you support the mind, body, and healing simultaneously through the use of SST, synchronized synergistic therapy. Um, I bridged into using this in my practice because after years of using other evidence-based trauma therapies, which are very effective, I found that I was reaching a stuck point with clients often when it came to releasing body patterns of stored emotion. So this integration of mind body into the therapy through SST has been the game changer in releasing the body from holding patterns and emotions from the body.
Love that. So key. And Dr. Sylvester, kind of give us a brief background on you, but also how you got into the SST world.
Yeah, thank you, Dr. Hart, for having us. We're excited to talk to other providers and practitioners about this novel therapy because it was something I stumbled across many years ago when referring to a colleague who was practicing this model and was sending patients back that had the fangs of PTSD taken out of them. Where I trained, which we had some more psychotherapy training than other psychiatry residencies, for instance, there was not anything about somatic based therapies, and particularly PTSD seemed to be a condition you managed. It wasn't something that was recoverable or certainly that you could mitigate symptoms in this profound of a way. So he was sending these patients back with a psychic shift, almost like they had a near death experience or some profound change in their makeup. Their nervous system was reset, their attitude of certainly symptoms like sleep, all of this got better. And as I learned the model and I learned the ingenuity of the application of existing tools that we already have as practitioners in a novel way, I was hooked. You know, psychiatrists don't do that much psychotherapy as terms of a percentage of their practice. And even then, it tends to be very supportive. This has revolutionized my practice because I can take some of the most stuck people, whether they're being seen through the lens of integrative health or functional neuropsychiatry, and actually move the needle safely and effectively and very quickly. So that's what got me into it, excited about it, and still getting so much out of doing this work at a time when people are struggling, I think now more than ever. So it's been very, very rewarding.
Well, I'm super excited to talk to you guys about that today because as three practitioners, right? So Dr. Sylvester, you coming from the medicine side, Megan, you coming from the psychotherapy side, and me coming from the background bodywork side, it's really a perfect combination today for us to talk about SST. So Megan, give us a definition of SST kind of from the practitioner's standpoint so that people can grasp as we're talking about why this is so key to get that true healing level. What is SST therapy?
Yeah, SST stands for Synchronized Synergistic Therapy, which is a psychotherapeutic model, meaning that we're connecting a psychotherapist with a body-based practitioner simultaneously live time in the session. We work together in synchrony to be able to support releasing emotions that are held in the body and support the body while releasing emotions and processing trauma.
Love that. And it's, that's so important from my perspective when we work with clients or patients in our clinic. For instance, this last week I had a patient, she was coming in, we were dealing with some mold illness and Lyme and all that sort of good stuff from the functional medicine side. But one of the things she said, I got this right shoulder pain, it's persistent. from a body worker side, I could have diagnosed that it was, bicipital tendonitis, whatever you want to call it, like, right? It had a straightforward diagnosis. But when we got to working on it, it was really a trapped emotion about our mother. And so doing just a tiny bit of body work, not a lot that you would do typically for that tendinosis diagnosis, but really doing some brief SST type work is what allowed her to get some real relief it was like a 5 year long shoulder pain. And so it's something we see all the time. And that's why we would love to refer some of the deeper cases to you guys. Dr. Sylvester, I want to talk to you each about some cases you've had that you would feel comfortable sharing about. Dr. Sylvester, give me an example of one case that really SST kind of broke open for you.
Well, I think one thing that fascinated me and broke things open early is how effective of a tool or a modality this is at accessing even pre-verbal, pre-memory, or repressed traumas.
Yeah.
Because typical talk therapy can't you can't really address it if you don't know it's there. And frequently, even if you do know it's there, you don't really know how to uncouple it from the somatic side of things. So one of the cases I saw was that early on that was recovery of a memory that the client was absolutely unaware of. And
Yeah.
then once they recovered that memory, they had to deal with that. It became like, wow, okay, how could I have repressed that? Now I'm vividly remembering details of this, and it's as if they opened a door in their mind, and we need to do that safely, and in a supported space. So, because this is one area of psychotherapy where if you aren't well trained and well informed, even with the best of intentions, you can actually exacerbate someone's illness and sort of rip the band-aid off, if you will, and have them psychically bleed out. So that's one of the strengths of this model is to be able to access that in general, but access it safely and then know what to do once you're in.
That's one of the things I really feel good about when I refer folks to doing SST therapy is as I know the model you guys have created is going to provide that support, right? So I see a lot of times I say, you dealing with trauma, whatever, we refer them out, they find their own therapist, and that therapist just unpacks all this stuff, but doesn't create that support network in between, and they're a bigger mess than when they started. And so when I refer somebody to you guys or to one of your trained therapists, I can feel good about it. So Meg, do you have kind of a similar concept of like what's maybe either a particular case or a generalized example of a case that you've seen is done really well? So like from a practitioner standpoint with SST therapy.
Yeah. Um, I think people who have done a lot of really great trauma work coming in and still stuck in some stuff. They've done
Mm-hmm.
they've done years of great trauma therapy with highly skilled trauma therapists using strongly evidence-based trauma modalities, and yet they're coming in and saying, I'm still holding my hips tight all the time. I still can't take those deep breaths. I'm still having nightmares. I've talked about it till I'm blue in the face. I don't have as much of an emotional reaction anymore, but my body is staying activated. SST has been really powerful in helping those people shift their baseline body state and the state of their nervous system and releasing those old patterns. And when we say the body keeps the score or the emotion is stuck in the body, that's part of what we mean is the body is holding on to these same repetitive patterns outside of their conscious control, right? These are automatic kinds of body patterns that are happening that they can't seem to get unwound. To what Dr. Sylvester was saying, also sometimes unconscious traumas. So when people have been through, whether it's a surgical trauma or maybe a sexual assault under the influence of a drug or something like that, or somebody who was blackout drunk and had certain traumas that had happened, those are difficult traumas to work with because we may not have picture memory or a narrative to be working with, yet the body is viscerally responding through symptoms on a day-to-day basis. Bringing in a body therapist to support the psychotherapeutic processing seems to be very effective in helping the body to tell its story, to speak in the language that it does have, to speak the memory that it does have, and release and repair and re-encode so that it doesn't intrude in the same kind of way.
I think that's so powerful to say, you know what, people have had really good evidence-based work. And so kind of from all three angles, that's why again I like this conversation as three different practitioners coming from the body side to the mind side to the medicine side is like look, it's not a shortcoming maybe on you as a practitioner, but we need to come together as a cohesive whole, as a teamwork, as an integrated framework, as that synergized, right? That SST, that synergized therapy to say, how can each of us bring something together, whether you come in and get trained with it or refer to it as a practitioner, bring that in together. It's not one or the other. You're not missing something in you as a practitioner so much as how can you bring something to the table. So, and what I would say is like, if you find that concept valuable, whether you're what I might call a mind worker or a body worker or a medicine worker, come get some of this training so you can find teamwork, in your area or down by you guys to bring this in as a setup because it's so key to healing. Whether your clientele know it or not, whether they have an explicit memory mentally, right, in their mind or brain, or it's in the encoded in the body, and it's what in the research we call implicit, right? It's like it's a feeling state, it's a sensory state that occurs but there not might be a thought or memory pattern associated with it. And so, regardless, when somebody's holding on to those things, those pain patterns, those symptoms, those tension patterns, whatever they are in the body, we got to deal with it together. And so, I love that aspect of SST. And so, as we transition to that and that thought process is, I would ask you from a practitioner standpoint, what does an SST therapy session consist of? And Dr. Sylvester, I would have you give just a quick overview, and I'm gonna have May go into it a little deeper. But is Dr. Sylvester, I'd ask you like, give me like a brief overview, like a few bullet points of what does an SST session look like for a practitioner?
Well, we have like a three-pronged phase. So we have a preparation phase, which is establishing with the patient, getting in with the therapist and the body worker separately, right? And then we enter into the navigation phase, which is the actual table work, and using the tools of SST and the collaborative work that we do in the room in real time. And then afterwards, an integration phase. So that's following up, checking in, usually within a week and seeing what's been activated, what they need to process, what they learned, what they experienced, what worked, what didn't work, and really support them during a crucially vulnerable time. I've mentioned before that a lot of times the effects are something as profound as a near-death experience or a psychic shift. Maybe people that do these transpersonal experiences, and so it's psychedelics in South America, they need to be processed. They need to be
Mm.
understood. They need to be integrated into the framework of their life, both past, present, and future. So this three-phase approach is typically what the structure of the SST process looks like itself. But May can tell you more about the in session if that's what you're specifically asking about.
So on average, there's about two, maybe three practitioners, a mind worker, like maybe a psychotherapist or somebody on that line, kind of like Megan, and then or maybe yourself, and then there's probably a body worker, whether that's an acupuncturist or a massage therapist, et cetera. So there's two practitioners, and so that first phase is really getting a background of the clientele or patient, and then getting them to know the practitioners. That's kind of that first phase. That second phase you're talking about, that's the actual SST session. They're in the room, right? And I'll have Megan describe that a little bit. They're in the room doing the work, doing the processing, and then later they'll do some integration work, maybe with both, not probably together, but maybe doing a little bit of psychotherapy work with a mind worker to integrate what insights were found, and then maybe some work with a body worker to integrate because those changes are profound. Like when I referred clients and patients to SST work, the post changes are profound and we've got to change it, right? So those are biggies. So that makes sense to me on that setup. And then Megan, give me an idea from a practitioner standpoint, like what's it really like in session?
Yeah, sure. So the room itself looks like a massage therapy room that we might traditionally think of. Typically, it's lower light. Typically, it's a massage table, and there may be music on. And I would put a caveat, so long as the particular client can tolerate all of that. So every
Right.
session is structured specific to that client. If a client can't tolerate laying down, we're not doing SST that's laying down or low light or music or whatnot. So it's tailored unique to them and their specific cluster of symptoms and vulnerabilities. We walk in, we check in, we touch base, we reestablish a little of that rapport in the room, And then pretty quickly at the beginning of the session, the client's invited to lay down, fully clothed, and they don't disrobe like in a traditional massage. And the body worker then will create contact with their body and begin to tune into their body, which basically means notice holding patterns, notice what's their baseline as they're walking into the room. We'll guide the client through typically some sort of guided relaxation or mindfulness kind of exercise to activate the parasympathetic nervous system, to take an inventory of what's going on in their body, emotionally, and their thoughts, those kinds of things. And then from that space, we all are getting different data. The client may start talking about what has come up from them between that last session and this session, what part of their trauma they may want to work on. The body therapist may say the patterns that they're noticing, something like that, and then we begin to process like a typical psychotherapy session. I will say it's a little bit. The processing is a little bit slower in terms of the dialogue, the back and forth. There's much more quiet time and space because we're encouraging that introspective awareness and interoceptive awareness and encouraging the client to notice physical shifts in their body as well and holding patterns. As we continue to do that, then as the session begins to wind down and we've done the trauma processing, we spend a chunk of time to make sure that their nervous system is contained, emotionally they're contained, and they're re-regulated and grounded before the session ends.
I love that. And having experienced it and like been a part of some of those sessions, it's so key to kind of open and close well, which I think you guys do amazing and train practitioners on doing amazingly well, is opening and closing well on that. And then really, I think for especially a lot of I've done so much psychotherapy on myself, even, right? Like going to different psychotherapists, and some are better at this than others of creating that environment. Like, hey, I just drove in, maybe I drove in traffic. Like, are you helping me regulate before I dive in? Or am I staying dysregulated? So helping them, I love that on that aspect. And from a research standpoint, guys, as practitioners, if you're listening to this, from a mind worker, but also in my experience as a chiropractor, Dr. Chiropractic is as a body worker, a couple key factors we see in the research for success is number one, rapport, right? How are you connecting with that person, slowing down, connecting? But number two is, can they activate that felt sense? Can they get into touch with themselves? So you guys creating that system and then integrating and slowing down, right? You're kind of saying that, Megan, is like it's a slower pace in your average psychotherapy setup. And I think even just from like my own personal analytical side, from a research standpoint, that's so important if you're going to really get to these deep things, because otherwise you're not going to be able to get in touch with that felt sense to allow us to actually release it. We might get through the talking part up here, but did our nervous system and the body get through it? So I love that you guys are doing, and having experienced it, of that back and forth between it's really it's this beautiful meld between what is the client telling you and experiencing, what's the mind worker saying on the psychotherapy side and helping them process from the verbal or even sometimes nonverbal, and then what is the body worker doing hands-on with what their body is changing in real time, right? Those tension patterns and those neurological patterns are changing in real time in a session, and observing that is so profound, you guys. If you're a practitioner, it's amazing to see, and I mean this in a level you can't grasp if you've not been in a true SST session. So I truly recommend you guys get the chance to experience that, because to see that make such a lasting deep change in a session is truly amazing. And so as I'm kind of saying, like, you guys got to experience this, what is the training like for a practitioner? Meg, why don't you jump in on that? Because I know you guys have worked so hard on putting this together. So Megan, what's the training like for a practitioner on that end?
Yeah, so the training is divided into two chunks. Basically, there's the theoretical component and then the practical application components. The theoretical component are online modules, 12 online modules that are self-study that you do from home and on your own time, to understand the theoretical underpinnings of the SST model and the way that trauma is stored in the mind body, and then also the integration of these other modalities. So recognizing that as a psychotherapist, you may not have a whole lot of intimate knowledge about what acupuncture is or how acupuncture addresses emotions. Same with neurofeedback and massage therapy. And conversely, a massage therapist may not know a whole lot about psychotherapy. And so there's also bringing everybody up to speed on who your colleagues are in an SST session and how that particular discipline addresses the mind-body connection and emotions and trauma stored in the body. After you've done those 12 the 12 online modules, then you come in for a 3-day in-person training where we do experiential work around SST for 3 days. There's some video trainings that are happening in there, but the bulk of it is getting in the room and practicing and receiving and working hands-on with each other and learning how to synchronize, learning how to collaborate, learning how to work with another practitioner of a different discipline that you may or may not have any experience with while supporting a client through trauma reprocessing or supporting a client's body as they're doing psychotherapy.
I love that. And so even, when I train a practitioner, I always joke my background is over 20 years of youth coaching as well, like sports. And so I joke, well, you got to learn the fundamentals and you got to learn strategies, right? So that contrast, I love what you're saying, but it even goes in deeper of like, hey, we're talking about hands-on work, mind work, medicine work, like all those integrations. And that's even how you're training folks, right? It's like, hey, get some of the mind and the knowledge right, come in, get the hands-on experiential. So I love that. Dr. Sylvester, what would you add to that as like from a practitioner standpoint, especially more so coming from like I think from Megan and I's fields of like psychotherapy, therapy, counseling, and even body work, this stuff is sort of makes sense. Like I think it's a little bit sort of baked in. I almost feel like medicine is the opposite, unfortunately, of like separation instead of integration. So like if you were to speak to like the MDs, the DOs, the nurse practitioners, those sort of folks, what would you say like is pivotal and that you really like about the training side of it?
Well, I mean, I think regular allopaths wouldn't, be able to participate, but they should know when to refer. In other words, this is a psychotherapy model, so the only people who are psychotherapy trained in the allopathic world are psychiatrists, really. And not all psychiatrists are trained well in therapy. So you really have to have a strong background, comfort level in trauma-informed psychotherapy care, but educating the field of medicine and mental health in general is crucial to know when to refer as well. And I'd also add that we have a website. It's linked below, SSThealing.com, but we do free discovery hours every month, and we have a lot of online resources that can give much, more personalized, in-depth, again, free access to this information to know when to refer, what the model is, what the training is specifically for practitioners, because, like you said, it is baked in. We had one of our psychologists who got trained say, well, there's nothing really new here. And we're like, that's the point. But when you cross the streams, all of a sudden 1 + 1 = 3. And that's where you can't argue with results. And I feel your passion too. And we're not trying to overblow or oversell this thing. I can honestly and sincerely say that this has probably been one of the greatest discoveries of my career. And it was simply taking existing models and building them in a different way, just like a box of Legos could be assembled into all different types of models. So I would encourage people to learn more online at that. Watch any of our informational videos or the Discovery Hour, and really start asking the questions that are near and dear to your heart to be able to offer this treatment to your patients. Know when to refer at the very least, but we really want to build an army of providers so it's something as familiar as other modalities out there. So learn about the training, come for the training, experience it, because that's what it took for me to go, holy cow, this is huge. This is something that comes along in a century.
It's
100%. And so
fascinating
I
how
would
people
go ahead,
shift.
Megan.
So sorry, I didn't mean to jump in. It's fascinating how people shift so quickly too. I could be working with somebody for 10 years in traditional psychotherapy and doing what I think is relatively good work with them, but meeting that stuck point. And then I take them into an SST session. And my approach, aside from it being I'm in an SST session, hasn't really changed, but the incorporation of the body work simultaneously moves the needle. Then all of a sudden we're into where we need to get to. If we're working with somebody with prolonged grief, and I've done the processing and the trauma work around it, and then our acupuncturist comes in and works with the grief meridian pathways, and then all of a sudden this stuck emotional energy that we couldn't get to is right there and able to be worked with. Or somebody who's super cerebral, and we bring them in and have neurofeedback start right away within minutes of the session instead of taking 45 or 50 minutes of an hour session trying to get an arrow over their castle and get into some sort of feeling of emotion within minutes. Now we've moved around their defenses through that neurofeedback programming, and we're able to access the emotion. It's fascinating how quickly it begins to shift things. Dr. Sylvester and I have said, once we see it, we can't unsee it. We can't go back to just practicing traditional psychotherapy anymore, because it falls short when we continue to operate with the mind and body as separate. They have to be addressed simultaneously.
Oh yeah, that's so key, and I love the way you put that. As like it becomes this emergent property when you start to do them together. The synergism, and really, I think Stephen Covey kind of made that even more popular. Is like 1 + 1 = 5 if you do it synergistically. Is that emergent property that occurs is so big. So guys, if you're and gals, if you're a practitioner, whatever practitioner you are, body worker, mind worker, medicine, whatever it is, if you've got clientele who are stuck, and I know you do, right? SST therapy is something you look at. Refer, great. I would love to refer to Megan or Dr. Sylvester. I think it's fantastic. But come learn, do a discovery hour, come take a session, take the modules, learn how to implement this into your practice. I know there's practitioners around you who can do this work with you, acupuncturists, massage therapists, psychotherapists, chiros, whatever it is. And so, guys, where do they find this? Where do they do discovery hours? Where do they get the online training? Where do they come for the workshops? How do they get a hold of you guys?
The good news is that's all available at the website below, the SSThealing.com. It's got information on the discovery hours. It's got information on the modality itself. It's got information on the training weekends, the dates, the cost, all of it. And also, we're open to talking to colleagues directly because our primary goal at this point is to build an army. It's to share this Lego set with experts, the thought leaders in that are passionate about trauma and that are so sustained and rewarded by this type of work. And that's why we get into this. And to have a tool as powerful as SST available to you is just putting us into the next century.
Love it. So they're going to check you guys out at SSThealing.com because this needs to grow. We need more people getting better because more practitioners are learning it. SSThealing.com. Go look at a discovery call. Go look at the online training. Go do a workshop. Thank you, Megan. Thank you, Dr. Sylvester, for being here today, talking about SST therapy, helping practitioners get better, helping them help their clientele and patients. Good to talk to you guys.
Thank you.
Thanks so much.